Hi, I'm Pamela Wilson, and today we are answering the question, do you feel like you know enough about your health? Are you an educated healthcare consumer, whether you are 20 or 100 years old? I'm Pamela D Wilson. My website is pameladwilson.com. On there, a lot of helpful information for caregivers and aging adults. I want to bring up this subject because we want to talk about barriers to patient education and patient engagement. And I know that those are terms that you probably rarely hear because they're terms that the healthcare system uses. And I want to talk about 3 reasons why consumers, patients, young adults, older adults, don't take a proactive approach to health. The first reason is that as a healthcare society in the United States, we don't really talk a lot about prevention, about preventing health declines that we might see in ourselves or in elderly parents, or how to prevent all those things that happen as we get older that result in us not being able to do all the things we used to do when we were younger and needing help from family. Part of the reason is that in the United States, the healthcare system is rewarded to treat people for disease. That system really doesn't teach you how to avoid disease because there's no money in prevention. There's only money in treatment. The healthcare system, doctors, hospitals, clinics, they are rewarded financially through health insurance and other incentives for treating sick people. But imagine this. What if consumers became so proactive and so educated that they didn't need treatment, that we didn't have to go to doctors as much? How would that change the healthcare system and the financial rewards if there were less rewards for treating people and more rewards for prevention? The other issue in the healthcare system is that the healthcare system has all these words and this terminology that they use. And most consumers have no idea what they're talking about. How many of you have ever gone to a doctor and your doctor started explaining stuff and you just got this glazed look on your face because you really didn't know what he was talking about or what she was talking about, but you were too hesitant to say, whoa, stop, let's put the brakes on. You just said something and I have no idea what that means. Can you explain that to me? Because healthcare providers work in the healthcare system and in the healthcare world, they talk to each other and they all understand what they're talking about. It's kind of like if you were in the workplace and maybe you're an engineer or someone who's very technical. In the workplace, you're talking about technical things and you're talking with other employees who understand what you're talking about. But if you translate that to consumer conversations, consumers might have no idea what you're talking about. That is the example of the gaps in patient education and why consumers don't always grasp what the healthcare system is telling them. One of the gaps is a lack of understanding of medical conditions and the short and the long-term consequences. And so what do I mean by this? If you have high blood pressure, do you know what that means today and 5 years from now and 10 years from now? Do you fully understand what other health conditions can relate to that? I was talking to a caregiver the other day and the caregiver said, oh my gosh, my mom has all of these health issues. And now she's starting to have wounds on her toes. Have you ever heard of this? Have you ever seen this? The doctor's telling us to take her to a podiatrist. Is that really what we need? Now, you would think that the recommendations of a doctor would be pretty sound. But in this case, I started asking a lot of questions. And as it turned out, her mom had a lot of heart issues, a lot of cardiac issues, which can result in circulatory issues, especially in the legs and the feet. My suspicion was that the reason that her mom was having wounds on her feet and her toes that weren't healing had nothing to do with dermatology, but had everything to do with circulation issues, which I have seen in many of my elderly clients. So could she go to a podiatrist? Yes, but podiatry really isn't the issue. The issue is a cardiologist. The issue may be going to a vascular surgeon to increase circulation, to increase the ability of her mom's wounds on her feet and her toes to heal. This is where even a lot of doctors can't give you appropriate guidance. And I know that sounds crazy because doctors should know this, but a primary care doctor isn't a specialist. And most consumers don't know to go to a specialist. So how do you manage all of these things that you should know that the healthcare system doesn't teach you? It's important to find experts like myself who have helped thousands of aging adults and elderly and caregivers of the elderly through a lot of these situations. Because if you don't have the exact experience of something, to notice something and to relate A to B, and to be able to ask the right questions, it's difficult as a healthcare consumer. It's difficult as a patient to figure out what is going on. So when we look at health and asking ourselves if we're educated consumers, I'm not sure that we can ever have enough education because there is so much out there to know and to learn. If you are a caregiver of a parent or a grandparent, or if you are an aging adult, there's a lot of help on my website. I do individual elder care consultations with people to talk about situations exactly like this. My parent is experiencing this. I am experiencing this. How do I manage this? What does it mean for the long term? How do I stay healthy when I'm older? Because I want to stay independent. I don't want to have retirement years where I'm sick and not feeling well and I can't do all the things that I want to do. But many times we don't think about this until we are in our retirement years. If that's the case, there are still things that you can do to become a more educated consumer, a more educated patient, and I can help. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, a lot of help for caregivers and aging adults. Thanks for watching this video. Please share it with other people that you know who are looking for hope, help, and support about caregiving, about aging issues, family relationships, all of that. That is my specialty. Thanks for being here with me. I will see you again soon in another video.